Let's talk about medical documentation. I know, it might sound like boring paperwork, right? But what if I told you that every single chart, every note you write, is actually a chapter in a person's life story? Seriously, it's a story that holds the key to their health, their recovery, and their entire future.
You know, in a world of high-tech diagnostics and incredible procedures, there's one document that really shapes a person's entire health journey. So, think about it for a second. What is the single most important story a healthcare professional will ever write? Yep, it's the patient's. Every single medical record is like a biography in progress. It captures these incredibly raw moments of vulnerability, of recovery, of resilience. Okay, so let's dive into this and figure out how to write that story with the kind of precision and care it absolutely deserves.
Every great story has a beginning, right? Well, in medicine, that first chapter is always the patient history. And this isn't just about collecting a bunch of facts, no. This is the foundation, it's the bedrock that every diagnosis, treatment, and clinical decision is going to be built on.
And any strong foundation needs a solid structure. This four-step process helps create a story that actually makes sense. You start with a chief complaint. That's the one big reason the patient is there. Then you build out the story of the present illness, laying out the symptoms in order. After that, you add in the crucial context from their past medical history. And then boom, you tie it all together with a quick, clear summary. This structure means anyone on the team can pick up that chart and get the picture instantly.
Now, this story is written in a really specific language, medical terminology, and using it with precision is, well, it's everything. Just think about it. A simple mix-up between hyper and hypo could lead to a really dangerous medication error. Getting the terminology right eliminates all that ambiguity. It makes sure a diagnosis made in one hospital means the exact same thing to a specialist halfway across the world. It's basically the universal language of patient safety.
Okay, now look at this. This is huge. See how our choice of words can completely change the plot of the story? That bias statement, uncooperative patient, it just judges them. It creates this negative vibe for the next person who reads the chart. But the objective one on the right, it gives you actionable context. The patient is anxious. Now you have something to work with. You can address the root cause. It's the difference between just slapping on a label and actually making a diagnosis.
So a patient's story pretty rarely stays with just one clinician or ends after a single visit. And that brings us to the next crucial chapter, the handoff. This is where the continuity of that story is absolutely paramount for keeping the patient safe.
Right. When a patient leaves the hospital or gets referred to a specialist, their story gets passed on, kind of like a baton in a relay race. And if you drop that baton, well, the consequences can be really serious. Discharge summaries and referral letters are the tools we use to make sure the next person in line can pick up that story without missing a single beat.
And this table here really breaks down the essential parts of that handoff. You've got a quick summary of the hospital stay, the final diagnosis, super clear instructions for the patient, and a solid plan for follow-up care. Each one of these is a vital piece of the puzzle. It protects the patient from having to be readmitted and actually empowers them in their own recovery.
Of course, today, these stories have pretty much all gone digital. They live and breathe and evolve in the super fast-paced world of the electronic health record, or the EHR.
And an EHR isn't just some digital filing cabinet, it's way more than that. It really is the living digital biography of a patient. It's a document that grows and changes with every single visit, every test result, every treatment, and it's all accessible in an instant.
But to be a good digital biographer, you've got to master the tool, and that means being almost obsessive about accuracy and every single entry. It also means using the EHR's features, things like templates and smart phrases, to be efficient without cutting corners on detail. A clean, concise, and correctly managed digital record is honestly one of the most powerful instruments we have in modern medicine.
Writing and maintaining the patient record is so much more than just a clinical task. It's a massive legal and ethical duty. And these rules, they're not just bureaucratic hurdles. Think of them as guardrails. They're to protect both the patient and the provider.
And at the very heart of all these duties is one fundamental principle. A patient's story is private. Protecting that privacy, whether the record is a piece of paper or on a secure server, is the absolute bedrock of trust in the entire healthcare system. It's non-negotiable.
And these responsibilities, they're active commitments. Upholding confidentiality is a given. But it's also so important to understand the legal weight of every entry you make. One inaccurate note can become a huge liability. Full compliance with regulations isn't optional. It's just part of providing safe, high-quality care. These principles are what ensure a patient's safety, their dignity, and their fundamental rights.
So we come all the way back to where we started. After seeing how this story is crafted, how it's passed between hands, and all the laws that protect it, we have to ask again, is a medical record just a file? Or is it your story, being written with the care, the precision, and the respect that you deserve? That's a question worth remembering.